I saw a post on social media the other day where a patient had gone to a plastic surgeon to discuss a belly-based breast reconstruction, so a deep flap, and they were really upset that the plastic surgeon kept referring to it as a reconstructive surgery and not a cosmetic surgery. So the patient was asking the forum, why don't plastic surgeons care about cosmetic outcomes? And this was really upsetting the patients on the forum. This is something that I see quite frequently on social media. So let's discuss what we actually mean as plastic surgeons when we say this. And there's a couple of points that we need to illustrate. One, we are making a difference between a reconstructive case and a cosmetic case. The first thing we're considering is who is paying. If it's a cosmetic case, you are paying. It's an elective surgery. You are coming to fix something. Tummy tuck, facelift, eyelid surgery. Versus a reconstructive surgery, it's covered by insurance. So that's the first difference. The second difference is, what is our primary goal? If someone comes to me for a cosmetic elective surgery, my primary goal is to give them the best cosmetic result they can achieve. And sometimes in order to give them that result, they need to lose a little bit of weight before surgery. It's going to make their cosmetic outcomes better. That's a cosmetic surgery. Versus a reconstructive surgery. As the name implies, the primary goal of a reconstructive surgery is to reconstruct something. In the case of the mastectomy, reconstruct a breast after all that's left after the mastectomy is a little bit of skin and fat. That brings us to our next discussion point, is what are our starting points? If you are reconstructing a breast, once again, we're just starting from skin and fat. We're not starting from a breast that we're trying to just look better. We are building a breast from the ground. Very different. But the other thing we need to think about is, especially for deep flaps, because I see this all the time, this misunderstanding about why, because it's a reconstructive procedure, are you not getting the cosmetic outcome that you want? It's because how we need to do the surgery. When we do a tummy tuck, my goal is to get your incision as low as possible so it's hidden in your underwear. That's my starting point. When I do a body-based reconstruction, I need to think about where the blood supply to my reconstruction is coming from. For the tummy, it's around the belly button. So I have to make my incision quite high, perhaps higher than I would have for a tummy tuck. This can make the incision after a deep flap somewhat higher than a tummy tuck. Maybe not as cosmetic as if we had done a tummy tuck. They're completely different surgeries. They have completely different goals. And because of that, they have different cosmetic outcomes. Now, I believe very strongly that you can do a reconstructive surgery and have a very good cosmetic outcome. But that still is not the same as an elective cosmetic surgery. Does this make sense? Let me know below.